Hello, folks. Mayor Tom Koch here. I'm joined by our Public Health Commissioner, Ruth Jones. I'm sure you're familiar with Ruth Jones. She writes quite frequently in the Quincy Sun. She's also been on Quincy Cable a number of times, sharing information about all kinds of things related to public health. And obviously, we have a little bit of an issue happening worldwide in the public health world, and we want to talk a little bit about it today,
Right.
Ruth. The city has confirmed we have our first presumptive positive COVID-19 virus case.
Right.
And as I understand it, Ruth, it stems from the same Biogen conference that was
Correct.
held in Boston.
Correct.
So it was, I know that we were reached out to by the state Department
Right.
of Public Health.
Right.
You want to talk a little bit about that process with the state?
Sure. So I'm in constant touch with the State Department of Public Health, and I got a call over the weekend that we had our first presumptive positive case. Just to let people know, presumptive positive just means that it was tested locally at the state lab at Jamaica Plain, and they presume that the person is positive until it is verified by the CDC, and it's sent off to Georgia.
Okay, so that's where the test is done for the federal level at the CDC.
At the CDC in Georgia,
Okay. That
right.
takes a little bit of time.
It does. It takes a few days
Yeah.
before you get and it may take even a little bit longer depending on how many cases are going in
Right.
at the same time. So
Okay. So there's a total of, 4 in Norfolk County?
there is,
5 in Suffolk County?
there
But
is,
my point is, they're all
Yep.
related to the Biogen conference,
right, I
correct?
can give you the exact numbers. It's all the 15 cases, 15 new presumptive cases that just came out over the weekend brings the total in Massachusetts to 27 presumptive cases. There's 28 cases. One is the original case that was confirmed from the UMass Boston student that is recovering. All 15 cases that were considered presumptive this past weekend had a direct connection to the Biogen employee conference in late February. And of those 27 cases, 23 of those presumptive cases are all connected to Biogen.
Yeah.
So,
So the point is, folks, the public health officials know the source. It's manifested itself with a number of these individuals. We want to share this information, let people know what's going on, but we certainly don't want to overreact or suggest that anyone should be in any kind of a panic mode. I know we've talked about this in conversation.
we have.
About that the flu is a lot more dangerous as we speak than this
Absolutely.
virus.
Absolutely.
Not to minimize it, I think we're going to be smart. I think that you've talked about it in a number of times about washing your hands and not
Washing
touching
hands.
your mouth and your eyes,
Right.
and just to be smart about it, like we do with the flu or any other time there's an illness issue. It's that time of year. It's that season. I never used to get the flu shot, but my
You've heard
doctor's
me enough,
office.
maybe, to say
No,
no.
I just
Yeah.
the timing of it. I was in my doctor's office this fall, and he said, "Oh, you're here. I'm going to give you the flu shot and the pneumonia shot." It's okay, because I'm in contact with the public all the
Right,
time.
right.
So I guess it does make sense, and I know that this virus has seemed to really focus on people with compromised immune system. Do you want to talk a little bit
Right.
about that?
So the virus seems to be hitting people that are over the age of 60 with underlying health problems such as heart disease, respiratory disease, issues with their immune system, compromised immune systems. Does not seem to be hitting younger kids at all, and so in a way that's a good thing because we can track it down to one group that's the highest risk.
And we should say that this confirmed case has no interaction with the schools.
Right.
No
this is-
kids, and
right.
doesn't have anything to do with
Woman
the
in her
schools.
40s, totally came from the Biogen conference, has no children, so and had very little travel through Quincy at all, other than coming from Boston, where she worked in her own car, home to Quincy. So we don't consider this a risk for the community.
Yep, and then she is self-isolated at this point. Is how it works, right?
She's
For how many days?
self-isolated. Well, she's self-isolated actually where she's a presumptive case. She's self-isolated until she gets 2 negative tests, and that can take a while. The tests are done every 4 or 5 days, but it can take a while before it actually comes back negative. She has to have 2 in a row that are negative before she can stop self-isolating.
So we're in lockstep with the state and the federal government.
Absolutely.
I know we're an entity of the state, and we're following their guidelines.
Right.
And I certainly know that your experience in the field, you don't necessarily learning anything new with their guidelines. I mean, it's probably, in your world, it's probably common sense approach to this.
It is. We do communicable disease investigation every day in the health department for foodborne illnesses, other types of viruses. This is just
As well as TB.
as well as
cases.
TB, and
Yeah,
we do
yeah.
that every day.
Yeah.
So it's the same approach, basically, same basic approach when you do contact testing and look at communicable diseases and figure out, how far you have to branch out and who has to be isolated. So basically the same thing, just a new virus, a novel virus, so nobody really has immunity to it, but same steps and the same types of guidelines from the state and federal government.
And we have had conversations by phone and in meetings with some of the medical entities in the area, but I know we're also meeting tomorrow
We are.
with representatives from South Shore Hospital, Milton Hospital, Manat Health, South
Right.
Cove Health,
Right.
Brewster Ambulance, our
Right.
fire police services, again, to make sure we're all on the same page and being smart about how we operate. But we want to make this information available to everybody because it did come about. We were notified by the state. We want to share that information with you, the public, and just remind everyone to be smart about things. This did emanate from that Biogen
Absolutely.
conference. She's self-isolated. This doesn't seem to be any imminent threat to anybody else.
It's not community
so it's-
acquired. It's
Right.
specifically from that conference. So.
No, people have questions about this. They
Right.
can reach out to you in your office, Ruth?
Absolutely. Please feel free to call the Quincy Health Department. My direct line is 617-376-1272. You can call the nurses at the health department. They are 1285 and 1286.
What about email?
The emails, all our emails are on the Quincy website, www.quincyma.com. Go to the health department,
.gov or
excuse me,
.com?
.gov. Sorry, I always say that wrong. And the emails and all the contact information for our entire department is there. So,
So quincyma.gov, go to
Right.
the health department, or call it one of those numbers.
or call it
if
one of
people have
those numbers,
questions.
and there's always someone there that will answer. If for some reason I don't answer, please leave me a message. I always get back to you before the end of the day. So, please call us. We're happy to help.
I just came back from Ireland, so my wife had the wipes ready for me, so we get on the plane, wiped all the tray down, which we do anyway under normal
Absolutely.
circumstances.
Anything you do for the flu, to protect yourself against the flu, are the greatest steps to protect yourself against coronavirus. It's the same type of things. I can't say enough. Wash your hands, wash your hands, wash your hands.
And talk about that. Count. You
20
count or you sing?
Well, it's 20 seconds total time. It's 2 courses of Happy Birthday. So I always say, I challenge people to go into the bathroom and start singing Happy Birthday, do 2 full courses, and you'd be very surprised at how long that it really is to wash your hands and how most of us don't wash our hands long enough.
Mm-hmm.
So, and you can sing it out loud if you want, or you can sing it to yourself, whatever you
You
decide
probably
to do.
also recommend, I assume, that I shouldn't assume anything, but I'll ask you. I know a lot of people use the hand sanitizers.
Right.
And when you use those frequently, there's alcohol in that, and it dries your skin out.
Right, so hand sanitizers don't directly kill viruses. They're alcohol-based, and they're great against killing certain type of bacteria,
Okay.
but they don't actually kill viruses. And so I don't want people to get a false sense of, I can just use hand sanitizer and I'll be fine. What they do is the sanitizer dries the skin in your hands, it makes it a place that the viruses don't like to live, and they fall off.
see.
But hand washing with soap and water is the best way to get all that stuff off your hands. So hand sanitizer is great in between until you can get to a sink. And until you can get to a sink, keep your fingers and your hands away from your face. We all tend to rub our eyes, rub our nose, touch our face lots of times during the day, and that's how viruses get into your respiratory system.
Yeah.
So.
Okay. So once again, we have our first confirmed case in Quincy, emanated from the Biogen conference. This individual has no interaction in any community events or anything to do with our schools. They're self-isolating at home,
Right.
and the health department continues to monitor that.
Absolutely.
And will do subsequent testing of this individual before they can then be released from the self-isolation.
Exactly,
Okay.
exactly.
Anything to add?
No, I just want people to know that we're giving you up-to-minute information on this. We don't want people to, people tend to get afraid when they hear about things like this. We want you to know that we have it under control. We are giving you up-to-date information, and we will update as necessary.
Great. Appreciate
Thank
your
you.
work. Ruth.
Thank you.
And I'm very comfortable you're at the helm of our health department
Thank you.
with
Appreciate
your background.
that.
And you got some great employees.
We got a great group.
So, and I'm also grateful for as I mentioned, we're getting together again tomorrow with the medical people around us. We've got some great organizations in the world, in this world, I should say, in the medical world, right in our backyard.
We
So,
do. Great partnerships.
it's good to plan and be prepared. But you know, really, nobody should really get too worked up about this. I mean,
No.
it's something we should also be cognizant of, and that's why we're sharing this with you.
Right.
And just be smart about washing your hands a little longer than you normally do. Right?
Absolutely. Maybe it'll be a good thing to make people wash their hands all the time.
Yeah,
the way they should.
maybe that'll help us with
The
the
way they
flu and
should.
everything
That's right.
over time.
That's right.
Yeah, yeah.
That's right.
Well, I appreciate your time today,
Thank you.
Ruth, and thanks for tuning in, folks.
Thank you.
Take care.